Wish we could tell you there's good news as far as medical specialists negotiating with the government is concerned, but that's simply not the case. And I say this, I wish, because there was some good news with respect to doctors, family doctors, just about a few days ago, a week or so ago. But the situation with medical specialists does not seem to be moving any further. And in fact, we heard from the Premier last week, Francois Legault, saying basically, I think his announcement was in French, it's not happening. We're too far apart there. I think his expression was, they're asking for too much. That too much, according to him, is 17% more as a hike in salary. Thought we'd try to find out more. Dr. Arsène-Joseph Basmadjian is a cardiologist at the Montreal Heart Institute. He's an advisor with the Quebec Federation of Medical Specialists as well. Doctor, thanks for being with me this afternoon. We appreciate it. Can I ask you, was the Premier accurate in his description? Is that really the sort of sticking point here, just that amount of money?
No, thanks, Aaron, for this. There's a few sticking points. Let's be clear on a few things. I mean, that first of all, since 2015, there's been no change there's been no entente, no agreement. And since 2000, for the last 3 years, since 23, we have absolutely no agreement with the medical specialists in Quebec. Now, definitely, we spoke together a few months ago, and the situation was somewhat different in the sense that it was worse because we were talking about major cuts and people leaving the province. Right now, the situation for medical specialists is a little bit better because we're not talking about cuts anymore, but this is a serious situation. People are not coming in the province. People are retiring early, and people are leaving are leaving practice or cutting down their practice. Yeah. And the reason is because one of the reasons is the lack of respect, and the other reason is why is the negotiation being so difficult? Actually, negotiations have started again for the last month and a half, and the reason they started was because Bill 2 was abandoned, which is now 25. And the reason they started again is because there was changes. There was changes in the health minister and in the Treasury. Discussions are going well with the Treasury and with the health minister. The buck stops at the Premier's office, and the Premier says no. And he says we're being unreasonable. The numbers could be debated, but let's be clear on one thing. We're not talking about increases, whether it be 11%, 14%, or 17%. We're not talking about increases in salaries. First of all, I don't make a salary. Any physician who's works on it's a service. We're paid per service. So you don't have a salary per se. And if there are any increases, most of these increases are not going to go directly in any physician's pockets. There will be some, yes, but most of these increases are to be able to fund medical specialists properly. Where is there problems? There's problems in underserved regions. We've been hearing about it just recently, how in Gatineau and in Abitibi, how there's so many shortages in medical specialties. The funding, if there's increased funding, which there needs to be, will help to recruit more physicians and keep physicians in those regions. There's huge problems. You heard about family doctor clinics closing. It's the same problem in medical specialties. We're talking about private clinics, but not private clinics for private medicine. This is public medicine, but they're privately funded clinics by physicians who have their own clinic, when you have your own office. And a lot of specialties have been pushed out of the hospitals, and they have to work in these private clinics. Dermatology, allergy, just to name a few. And there's certain ophthalmology clinics and radiology clinics. All these clinics are funded by the physicians. Well, in the last 10 years, everyone's pay has increased, everyone's rent has gone up, but the physician's income has not gone up. So this is going to help fund these clinics and save some of these clinics. So a certain percentage of that is going to go to that. So it's not going directly in anyone's pocket. It's to be able to cover cost. There's medical research being done in Quebec, and there's research funded by the RAMQ, but it's limited in time. So after a certain while, after these researchers have, basically built a profile and built strength, they lose funding. So some of that funding is going to go to that. There's there's chiefs of staff who are funded very differently depending on the centers, but there's no central funding base. So a lot of the money is going to go to basically help and catch up partly our system. So no matter what the debate is, we certainly don't think we're being unreasonable after considering that since 2015 there has been no change. Yeah. So we do not agree with the Premier.
You mentioned the number of doctors leaving, and we had a story last week, a report last week showing over 1,000 people have left the system here, and I know there's also those leaving public to go private. Is it the same for medical specialists, the point where you've been going at this for so long now? Why even bother? There are plenty of places that would like to have you work where you can make whatever money it was you wanted to. Are we starting to see that with specialists as well?
Yes, we are. We've seen our certain specialists are leaving. In my own institution, already one cardiologist is leaving for another province. That's confirmed, and there might be 2 or 3 more. They're definitely considering it. We know. We're having trouble recruiting. The CARMS, just again, this is not just in my hospital. Obviously, it's all through Quebec. The CARMS is the Canadian Residency Matching System. It's a program that all residents apply for different, whether it be family medicine or for specialty positions in different provinces. So it's a Canadian system. In the CARMS, there's always some positions that are not filled. In other words, these are residency positions that are offered but have never been filled. So it's from lack of either interest or people going elsewhere. In the last 2 years, 50% of CARMS positions that are not filled are in the province of Quebec. So there's a problem here.
Yeah.
People don't want to come here to train. If they don't want to come here to train, they're not going to come here to practice. So that's just another number showing what's going on. I'm personally slowing my practice down because and I'm not leaving. I'm not going to private. I don't want to go to private. I want to work in the public system. I believe in the public system. I still do. But I'm one of these physicians who's going to slow down earlier than planned. I had 5 years, and now it's going to be in this year. I'm going to slow down.
But slowing down why? By virtue of what? Of the fact that you can't get a deal done?
No, lack of respect. It's just at one point because you do it because you want to do it, right. You do it because you enjoy doing it, you do it because the love of the practice and want to take care of patients. But just at one point it gets to you.
So when you say lack of respect, you mean with the government lacking the respect for your profession?
I believe it. Yes, in my case, yes, and a lot of people feel the same thing. We're not talking about people who are leaving. It's a difference. There's lack of respect, and there's also lack of recognition financially. We are now again. We've gone back to being the lowest paid physicians, specialists, medical specialists in the country. So, I mean, I'm not complaining about the income. It's just that at one point, it just gets very hard to take.
Well, I understand it. I wonder, too, I was talking to someone last week in a different situation who's leaving the public system to go private, not because he wants to, but because there's an up-and-coming professional who he wants to be able to afford operating room time to, and if he stays, given the limited number of time or hours that he has, that's not going to work. I mean, is that part of what you're seeing here as well? Do you not have the time you need to perform the surgeries you need to?
Well, okay, so for surgeries and procedures, the problem is there's multiple issues. The main issue is personnel and time in the sense of availability of operating rooms or procedure rooms or even equipment to a certain extent. But yes, the problem is because lately, the last few years, there's been really personnel issues, whether it be nursing or support staff. So the physicians, often the government would kind of, say that it's physicians who don't want to do the work. There's no physician I know who doesn't want to do the work. If you give a surgeon an operating room, they will operate. The problem is operating rooms are closed early or operating rooms just aren't opened. And then what happens is patient wait lists get longer.
Sure.
And that's usually because of staff issues or because of funding issues in institutions. So it definitely, we've always said at the Federation is that you give us the people, you give us the material, you give us the time, and we will deliver.
Is that a failure in the system then? Because this is not the first time I'm hearing this. This is a problem I think that's been endemic to Montreal, to Quebec.
To Quebec, yes, it is a failure. It's just that it's a failure, but it's an ongoing failure, and unfortunately, we are open to discuss solutions. Yeah. But in the last few years, in the many years actually, it's not necessarily the latest government, but it's happened one government after the other. Instead of sitting down at a table and discussing, we're not talking about negotiating. We're not even talking about income. We're just talking about the healthcare system. Instead of listening to people in the field, it's always from top down. I think I've said this before on air. It's just instead of collaborating, we're just working unidirectionally. And I think we can definitely improve that.
Has it made no difference with the departure of the health minister, Christian Dubé, because he seemed to not want to be very flexible? He's gone. You're not getting on any further because, as you just said earlier, it seems the buck stops at Francois Legault's desk here, regardless of what you're negotiating.
Yes, just a clarification though. Right now, the talks are still much more cordial and the interactions are much healthier.
Okay.
Let's say, with Madame Bélanger and with Madame Duranceau. So definitely, whether it be the health minister, the new health minister, or the Treasury board president, they're much more cordial and we've advanced. It's just whenever we get again to the point of making a final decision, and we have made concessions, the government has made changes also. I think we're finding we're near an agreement, but unfortunately, when it comes to the numbers, when it comes to the crunch, and because everyone needs a certain amount of funding to be able to do all the programs, as I said, we want to be able to get done. It's not passing at the Premier's office.
Can I just, I'm not sure if it's a fair question to ask, but there's an election coming up in October. From what you've heard, have you had conversations with other parties? Would you be hopeful that if this government did not get reelected, it would make a difference?
I really can't answer that question because I don't know. I'm not at the negotiating table per se, and we don't know what the future holds. So certainly what we do know now is that it's not working right now. And pressure-wise, we want to do, we're unfortunately in a situation where we have to start certain certain pressure tactics, but we don't want to affect patient care, certainly not directly. So there's no pressure tactics directed at the patient or our patients that we're following or we're treating. So what it is it's medical administrative again. It's things that we already do not really get any kind of funding for that people have always done. Just historically, physicians have always helped out and gone to meetings, after our meetings, even during the day meetings. But at one point we just said, well, listen, you want us to concentrate on the patients, which is logical. We're going to concentrate on the patients, but we're not going to cut clinics in order to do administrative meetings. And administrative meetings are not recognized in any way, but they need physicians to do them. But unfortunately, at one point, we don't want to affect patient care. So this is one of the only places where we can do pressure testing.
So I'll take it, the fact that you say negotiations, at least now, you think you're getting someplace. It's more optimistic than you've been in a long time. Is that fair to say?
Yes, we are more. Okay. I personally am more optimistic. I think we're more optimistic, but there's still that last step that has to be.
Okay.
We want to get there.
We will leave it at that. Dr. Basmadjian, always appreciate the time. Thanks so much.
Thank you.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian owned and operated. Charm has been part of your love stories and bromances for over 50 years.
And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.